Hey, I'm Dr. Jerry Chidester, aka Dr. Chitty. Thanks for joining on my channel. We're gonna be answering some questions today about plastic surgery, things that you guys have asked about. First question came from an Instagram follower. It's about extreme weight loss and skin removal, but in patients who are a little bit older. She called herself an older woman. So let's talk about the safety of that and how skin removal surgery can actually be really beneficial for a lot of patients, regardless of age. So first off, extreme weight loss, whether that's from medication or whether that's from surgery, patients will lose that weight and the skin just does not contract. And then it becomes actually a problem functionally for patients. Now that it's hanging, it gets caught in clothing, it can get kind of macerated, get irritated and rashy. There's a lot of reasons that skin removal can be an awesome surgery for a patient. One of the things that concerns people though is their age. And for the most part, I tell patients, look, if you're medically healthy, you otherwise are fit for surgery, you can totally do these elective procedures. The main thing is you wanna plan and do it in a location and a place that's safe for you. So many times my patients over 60, I will do them in a hospital setting. So if we're taking out skin in their arms or their thighs, or doing a fleur-de-lis tummy tuck, we'll keep them overnight and monitor them. And that's mainly to make sure their pain is well controlled. We have a nurse on staff who's gonna make sure that they're getting the nutrition they need, they're getting up and walking, going to the bathroom. All these things are super important to have you make sure you have a really good recovery. So yeah, it's very possible if you are considered a quote unquote older woman, as this person stated, and having skin removal surgery. The next question came from another patient on Instagram who was asking about options for her boobie after she had significant weight loss that she felt like they left her feeling bought. So let's talk about what we would do to address that situation. Think about breasts. When women either gain or lose weight, or if they have a pregnancy or a breastfeeding, the breast volume can change significantly. A lot of times a lot bigger than they normally are at baseline, but then that skin just doesn't shrink back down. And so you're left with really hanging skin. And the integrity of that skin, and the quality of it is just not good. So a lot of times these patients, we have to do what's called a breast lift or a breast reduction. That would be removing all that excess skin, moving the nipple and the areola into a more favorable position, so somewhere that looks more perky, and then removing excess tissue that's hanging down. Now sometimes we can use that extra breast tissue and move it into a higher location. We call that breast auto augmentation. That's a really good way to add some volume without having to add either an implant or fat grafting. But sometimes patients will need those things like a breast implant, because implants in the end are structural. They actually provide a fixed volume. So when we're trying to reduce the size of your breast or remove some of that loose skin, you're gonna actually lose volume, and your cup size can go down significantly in that situation. So we wanna replace the volume to make them look perky or full using typically a breast implant. But in the end, yeah, there are definitely things that can be done so you don't feel like your breasts have been left botched after you've lost that weight. So question number 3 comes from someone online who said, I was asking about recovery time for diastasis repair. So they're wanting to know how long do they need to take off work after they've had their diastasis recti repaired. Let's talk about first off, what is a diastasis recti? So diastasis recti, or DR, is when your rectus abdominis muscles are separated after typically pregnancy, but sometimes after weight loss. So we can see this in both men and women. Diastasis recti can cause a lot of functional problems and also aesthetically not look great because it looks like your abdomen is distended all the time. So diastasis recti repair is typically done at the same time as a tummy tuck, because a lot of times when we're trying to repair those muscles, we're actually having to remove extra skin and stubborn fat from the tummy as well. So that's what's part of what's called an abdominalplasty or a tummy tuck. But the diastasis recti, once we've put those muscles back together, we don't cut anything along the muscle fascia to do that. But then the instructions typically are, we don't want you to really engage your core for the first 6 weeks, meaning no exercise or something that's gonna strain that repair that we did, try and pull it apart. So a lot of times after 4 weeks post-surgery, you can start doing things like upper body or lower body, but really not activating your core. So by 3 months, a lot of patients are feeling back to normal, even before they had the diastasis or before kids. And then at 6 months post-operatively, a lot of patients feel even more strong than ever because they're able actually now to engage their core, activate it, and feel a lot better. All right, so question number 4 comes from Monica. She's asking and is curious about treating scars after having had plastic surgery. So let's talk about all the options. There's a huge spectrum of things we can do to treat scars. We can't prevent scars from plastic surgery. Now, we can always try to hide scars, but really as soon as we cut through the epidermis and dermis, that creates a permanent scar. We just don't have the technology nowadays to make a scarless surgery. However, we have a lot of cool technologies that can help hide hide the scar, minimize the scar, flatten the scar, lighten the scar so that it really is almost imperceptible in a lot of patients. So scar treatment actually begins sometimes before you even have surgery. There are certain products that we use, for example, Elastin's Reform and Repair. I give that to all my patients who are having tummy tucks, liposuction, breast surgery, and they actually start applying that anywhere from 2 to 4 weeks before surgery. During surgery, technique of the surgeon is also pretty important. Genetically, for people, they can get keloid scars. So keloid scars are where scars grow way beyond the area that the original injury happened. So like you see this in people with ear piercings. They just made a tiny pinhole to make a piercing, but they get a huge keloid scar. After surgery, there are a lot of ways to treat scars. Usually within the first 4 to 6 weeks, we can start doing certain laser treatments on the scars to help thin the scars and help the coloration of the scars. And then sometimes we actually inject certain materials or substances that actually can help tell the scar to calm down. And then I mentioned earlier about Reform and Repair. We have you place on your scar. There's also silicone sheet. There's a lot of other products. In the end, time is the best. Time helps scars mature and turn lighter over time. So time is actually another big component of that. Question number 5 is about fat grafting. So Eliana was asking about what procedures involve only fat grafting. So let's talk about where we can actually place fat. So when we take fat from one area of the body to another, we transplant it, that's called fat grafting. So there's a lot of areas in the body that we can fat graft. Everywhere from the face almost down to the toes, quite honestly. Fat grafting is a great adjunct to a facelift surgery. It can help really give a youthful appearance. So as we move down, breast fat grafting is very popular and has gained even more popularity as there are some women who just do not want breast implants, and that's great. I tell them, you know, fat grafting in the breast is like an upfront investment. A lot of times for the breast, we have to do 1 or 2 sessions to get the volume that you want, but after your body's kept that fat, it's gonna be there permanent. Whereas implants, you have to come in once and then in 10, 15 years again, and then you kind of repeat that process. Now we can fat graft other areas. We fat grafted into the abdomen, into the rectus muscles to give you more contouring. We can fat graft into the pec muscles, especially in men, they like to have more full upper chest. Now obviously we've all heard of Brazilian butt lift. So a Brazilian butt lift or BBL is a surgery where we take that fat that we've liposuction, transfer that in the buttocks to give a more projected buttocks. So those are kind of the main areas. Now in the end I tell patients, you know, fat grafting, only about 70 to 80% of it survives permanently. You know, there's some really good studies to show that things like Viality, Revolve, and these other products can help the fat survive really well. So question number 6 is about pregnancy post tummy tuck. So Tarika was asking us about pregnancy after a tummy tuck. I get this question a lot. I was like, can I have a tummy tuck and then get pregnant, or should I wait to be done having kids to have a tummy tuck? My resounding and absolute answer is yes, you should wait. Why is that? Is it the end of the world if you have a tummy tuck and you have pregnancy? No, I've actually had 1 or 2 patients over the last few years who were not planning on getting pregnant and ended up having a baby after their tummy tuck. And I guess the main issue with that is it's just financial, because yeah, we do repair your muscles, but those can always stretch out again if you have a pregnancy. The main thing is against finance, because you have to come back again, have another tummy tuck surgery to repair your muscles potentially. And then you do expose yourself to more risk. Anytime you have surgery, there's always risks of, you know, surgery, anesthesia, bleeding, you know, infection, all these things. But it's not the end of the world. Yeah, if you obviously you're not planning it and you have a pregnancy, that's fine. My one patient, she actually had several kids before, had her tummy tuck, super happy, had an unexpected pregnancy, and said it was the easiest pregnancy of all of her pregnancies. She had many. So yeah, I think, you know, I would not recommend you get a tummy tuck if you're wanting to have any more children. Now there are other options though. So sometimes people have loose skin, maybe they've lost weight, but they're planning to have more kids and it really bothers them. You can do what's called a paniculectomy, where we don't actually tighten the muscles, but we remove that loose skin. And that is one way to actually kind of remove the skin that's bothering you without having to worry about the muscle repair and all that stuff. But again, it is surgery and it does cost money. So just keep that in mind. All right, so I've been getting this question more and more. This is from Dusty about implant placement for thinner patients. So traditionally, you know, patients will get implants placed underneath the pectoralis muscle. We call this submuscular, but more and more we're seeing patients who are interested, you know, they're really active in life. They don't want to affect their pec muscles. They want a natural feel. So more and more patients are wanting what's called subfascial augmentation. Subfascial augmentation is where we actually go 1 layer above the muscle, or muscle sparing technique, where we don't cut any muscle, and we actually separate the muscle from the pectoralis fascia, which is the muscle lining. It's a thick white lining, and we place the implant between the muscle and the fascia. So it's still not in the breast tissue like a subglandular is, but it's right in that layer there. So that is a spot that can be placed, doesn't affect when you're doing push-ups, pull-ups, and those activities. However, in very thin patients, there's always a concern that you could potentially see the implant easier, right? So instead of having coverage on the muscle in the top portion of the implant, you don't have that muscle covering the implant because it's on top of that, and it's maybe more likely you can see it. And so what I typically do is I will pinch the upper breast pole. And if the upper breast tissue is less than 2 centimeters thick, or if it's really thin, then I do recommend fat grafting. So even in thin patients, we can find fat in the inner thighs, the knees, sometimes the outer thighs. And then I also use a very gummy implant. I use the most cohesive implants because they hold their shape really well. In the end, if you are super thin, it doesn't matter if it's under the muscle or under the fascia. I've had patients who have come to me to have their implants exchanged that are under the muscle, and you can see their implants. And if you have saline implants, it's even more visible because you can see the scalloping or the edges of the saline implant. When it's overfilled, you can see the rippling for sure. So in the end, under the muscle doesn't guarantee you're not gonna see it, but there are ways that we can address those issues if we're concerned about it. So this is a question about cone-shaped breasts she wanted to address. She said, what are the options available for correcting cone-shaped breasts, and what does this procedure involve? So this is a really good question, Megan. So when we think of cone shape, some people call it tuberous breasts, and maybe this is what you have, where the breast shape is actually, breast tissue is herniating through the areola. So it does almost give this kind of protruded or coned look, and that can either go forward or be going down. So a lot of times what we have to do is the ring around the areola is compromised, meaning the tissue is herniating through that areolar ring. We want to restore that. So sometimes we'll do what's called a purse string or wagon wheel suture, permanent one, around the areola to really bring that together and hold that ring so that the breast tissue is not herniating through there. So that helps prevent that coning. And then to address the shape of the breast and volume, a lot of times we'll place an implant. I think a subfascial is a great approach for not having to cut the muscle. And then I also typically do support, so I'll do internal bra support to help keep the implant where we want it to be, but also help with the shape. And I like the internal bra for these cases because it gives more predictability for me. I know where the implant's gonna go and it's gonna stay. And then we do the lift like I talked about around the areola. And then lastly, I do fat grafting. So if the shape of the breast is coned in some direction, and we want to add volume to round it out, then we would fat graft in the areas that we want to round out the breast. So I do this quite a bit as well. So those are all ways to address a cone-shaped, or sometimes they're called tuberous breast. So here's another question about diastasis recti repair, very personal and important topic. This person who asked me on there, she asked, could you explain how diastasis recti is repaired and what's the recovery process looking like? Essentially, a diastasis recti repair is after you've had kids, if your muscles are gapped and separated, we actually sew them back together physically. We elevate the skin and fat on your abdomen. We look at that muscle fascia and we repair, we sew it back together. And your body will fuse that back together after a period of about 6 to 12 weeks. So once that's fused, you can go do whatever activity you want. It's back to where we want it to be. Sometimes we overcorrect that a little bit because it always wants to stretch out a little bit. One thing I do advise patients is it's really important to try and get to your goal weight. So getting to your goal weight can actually help reduce visceral fat quite a bit. And once you get there, we're able to actually tighten it more and pull out more skin. So that's super important, and I recommend patients to get their goal weight. We have a wellness clinic now that we really love to help our patients get there. So before I say, nope, sorry, go find someone to take care of your weight goals, but now we really can do it in-house, and we'd love to help you with that. If that's an interest for you, definitely give us a call at my office. Okay, the next one is about Renuvion experiences. They're actually asking questions about Renuvion. She's wondering what have the experiences been with Renuvion for skin tightening and who's the ideal candidate for this procedure. Love this question. I really do like using Renuvion. So after we've done liposuction, the liposuction cannulas we actually pass the Renuvion wand, looks similar to liposuction cannula, through the same incisions we did liposuction, and we pass that along the tissue. So this plasma, this purple plasma energy heats up the tissue as we're passing this wand, and it stimulates collagen and elastin. So there's a lot of indications for this. We use it all over. I've used it everywhere from the submentum to tightening skin even on the breast, to the arms, to the inner thighs. Essentially, it can really help the skin contract in all these locations, and it's actually been really good. I think, I'm pretty conservative with it though. I don't like to overdo it because you could get issues with burns and things. I've never seen that happen with Renuvion, but it is possible, so we always have to be really careful. M Doodles was asking a specific question on liposuction, said, what is air sculpt and how does that differ from traditional liposuction methods? Air sculpt, they're really smart. This is actually a total branding, marketing thing that they've done. It's awesome. The Somi breast augmentation, all that is I've taken procedures that I've customized to put together and called it the Somi augmentation, because it's hard to say, hey, we're gonna do a composite breast augmentation surgery. Like, no one wants to hear composite. That's what it is, because we're using different components to create your breast augmentations. And in terms of branding, yeah, the Somi breast augmentation, people can remember that. So AirSculpt is the same thing, you guys. They've done a great job, but there's a specific company, but they call it AirSculpt. So AirSculpt, they make these small incisions like we would make. They say they use like this air gun to inject it, but in essence, you still have to make an incision. Because they're doing liposuction, they're doing Renuvion, they're doing the Ovally cellulite treatment, all through these same incisions. They've just branded it and called it AirSculpting, which I think is smart. But in the end, yeah, you're getting liposuction. So I wouldn't look at the technology. I'd look more at the results of that plastic surgeon and see if those are results that you're wanting to have done. This is a question about breast lift versus breast augmentation. So Sheena was considering enhancing her appearance, but she wants more information about breast lift versus breast augmentation. She asked, could I explain the differences between a breast lift and a breast augmentation? How do I know which one is right for me? So I think let's fundamentally talk about what's the difference between a breast lift and a breast augmentation. So a breast lift is rearranging the breast tissue, moving the nipple complex up. So once we moved it up in that position, a lot of times we have to take out some of the lower heavy skin and unwanted breast tissue. So that's part of a breast lift, is removing excess tissue. And many times I tell patients a breast lift is actually going to make you smaller. So if you think about it, we're taking out tissue. So when you remove tissue, you're gonna be smaller. Now sometimes you have a lot more skin than breast tissue. So you may look at your breast before a breast lift and say, oh, you know, I have pretty big breasts. But if you realize that when you just take out that skin, your breast will become way smaller. So you're no longer hiding that breast tissue within that skin envelope. So a lot of times we do a breast augmentation at the same time as a breast lift to restore volume that you're wanting. So that brings me to breast augmentation. What is that? Breast augmentation is augmentation mammoplasty, we call it in plastic surgery, is adding volume or enhancing volume of the breast. And that can either be through a breast implant or it can be through fat grafting. But the most common would be breast augmentation with implants. So implants are placed to add volume. Breast lift, again, is to lift the nipple to a different position. So a lot of times we have to do both, especially if you've breastfed or had kids, you have to do both. So hopefully that explains the difference between breast lift and breast augmentation. So Heather is actually asking about specific procedure here. She's asking, what's the primary differences between a paniculectomy and a tummy tuck? And when would you do one versus the other? So we kind of mentioned this earlier. I was talking about the spectrum of like skin removal after pregnancy, but a paniculectomy or your panis is where the skin is hanging. A lot of times it hangs even down past your pubic area. And this can be like really troublesome for patients. So paniculectomy is just removing the skin. Sometimes we do cut around the belly button and pull the skin down to get even more out. There's no muscle tightening with a paniculectomy, so that's the main difference. Because a tummy tuck or abdominalplasty is removing that same skin, cutting around the belly button a lot of times, but also repairing the muscles. So that would be a true abdominalplasty. That's the main difference, is what you do with the muscles underneath. So paniculectomy is kind of like everything above the hood, and then the tummy tuck, the muscle repair, is everything under the hood. So hopefully that helps. Really good question. This is coming from Rachie. She's asking about saline versus silicone implants. So can you break down the pros and cons of saline versus silicone implants, and how do I decide which one's best for me? So let's start with the pros and cons of saline. So a lot of the pros that you hear about saline is one, cost. The cost of a saline implant, that's just a silicone or elastomer shell. So it is silicone still, but it's just the shell of silicone. Whereas a silicone implant is silicone all the way through. So the cost of it is a lot less than saline, because you're filling saline filled implant with saline, which is, you know, injectable saline. It's like water, you know, salt water. That's what's going in the implant. So that is one of the pros, the cost. So for some people, whether they're younger or financially, you know, they don't want to spend money on silicone, they can do saline. That's great. The second pro I would say for saline is you actually would know if your implant's ruptured or not, because that can be a little concerning for some patients though, if they woke up one morning and their implant was ruptured. So that is maybe one of the cons of saline, but the pro again would be you would know if it's ruptured. Silicone, a lot of times you don't know if it's ruptured. You have to go get imaging studies to find that out. So that's one pro of saline. The other pro of saline for some people would be the actual volumes you can obtain. So I did a video a while back, you maybe not have seen it, it's on my Instagram, where we filled a saline shell implant to 6,000 cc's, 6 liters of fluid, and it still didn't rupture. Saline implants can go a lot bigger than 800 cc's. So in the United States, the only FDA approved breast implants for cosmetic placement are 800 cc's silicone max. So some women need more volume just to even be proportionate, or some women want more volume because they want larger breasts. So we can achieve that with saline implants. We can go, again, pretty much whatever size you want. You just can't do that with silicone. So some of the cons of saline, one is the visibility and rippling. So a lot of, especially thin women or active thin women, you can see the edges of the implant. That could be unsightly for some people. Two, one of the cons for saline is the feel of it. It does not feel natural. It feels like a water balloon or a water bag. So the feel of it, and now sometimes if it's overfilled, it can be like rock hard and maybe somebody wants that, but most people consider that a con. So silicone pros, the pro of silicone, again, it's kind of opposite saline for some things. Natural feel, they feel very natural and less chance of seeing rippling and all that stuff. Now the con would be cost, so it does cost more than the saline, and then you don't know if it's ruptured a lot of times, and so they do need to be exchanged. Now both need to be exchanged at some point. I typically recommend 10 to 15 years after you had them done, but it could potentially be longer as long as you're checking in on them. One other cons of silicone is, I mean, there's a potential if the silicone does crack, you could have silicone leak. Your body typically walls that off and encapsulates it, so it's not like the silicone's traveling your body, but it is possible. It could get into your lymph nodes. There's some studies that show show that gel bleed and things where silicone has gotten into some of the lymph nodes in the armpit. Whether that did anything or not, we don't know, but it has been found. So that's something to think about. But in the end, it can be very rewarding surgeries for patients to have either silicone or saline. So it really is gonna be up to you which pros and cons fit you the best. Thank you everyone for tuning in. We went through a ton of questions today. I hope that gave you more insight into some plastic surgery procedures that are both common and maybe less common. So hopefully you learned some information there. If you like the things that you saw today, please like and please follow me here on YouTube. I want to do more and more of these longer videos, these Q&As and other educational videos to really help people learn about plastic surgery, break down the stigmas, help educate you so that you can make the best decision possible for you. If it's something you're wanting to do with this plastic surgery or not, or if you have a loved one or someone, I hope this information can be helpful for you. So please subscribe to my channel here. Definitely like this video and comment if there's something you want to hear about. If you have a question about anything specific I didn't go over, definitely leave that in the comments and we will do another video. Thanks you guys, thanks for tuning in.